Hey guys, Tyler here with HPHI, and I want to take some time today to go over a question that I get a good bit from my patients that are suffering with thyroid symptoms, or they aren't sure if they have thyroid issues because they haven't done the appropriate blood work yet. And the question is, how do I better manage my thyroid medication? And what they mean is that how do I stop feeling these highs and these lows throughout the days, throughout the weeks? And the issue is, it's not about the medication. It has more to do with your body's response to thyroid hormone. And so here's what I mean. What we're looking at here is what your T4 and your T3, which are both thyroid hormones, what the levels can do um, whenever someone has what's called Hashimoto's. And Hashimoto's is the autoimmune disease for the thyroid. So what happens is that you have leaky gut or intestinal permeability, and when you eat, your body reacts to certain foods that get into the bloodstream, and then your body creates antibodies to fight those certain proteins that they're responding to. The issue is the same receptors on the food particles that you're fighting are on your thyroid gland. So you're going to fight not only the foreign invaders that your body thinks is the undigested food, but you're also going to destroy some thyroid tissue in the process. And what happens is that when you're currently taking medication or not, you're basically, whenever you have these attacks, so you eat a certain food, your body reacts to it, and you have this antibody attack on the body. And what happens is it attacks the thyroid gland, and you're going to release more thyroid hormone during those attacks. But then after the attack, your body starts to heal a bit, it's going to drop because you have a negative feedback loop. That's what TSH does. So thyroid stimulating hormone is telling your thyroid to either increase or decrease the amount of thyroid hormone that it needs to produce. And so you can see that if you're taking thyroid medication and you're continuing to trigger these attacks, you're going to constantly feel this up and down, up and down. And the other issue that comes with it is that if your doctor tests you, so you go to your doctor, you're complaining about the symptoms, and they test you, well, if they test you here, they're going to say you're hyperthyroid. So they may decrease your medication, they may take you off of it completely. If they test you here in one of the troughs, what's going to happen is they're going to over-medicate you because the feedback loop's kicked in. So now you're going to start taking more medication, and you're going to continue experiencing this constant up and down, this racing and then low energy feeling. So the way around this is to figure out what's the root cause of these ups and downs. And most of the time, it's due to leaky gut. And you can test that. You just have to run the right test. So if you're currently taking thyroid medication or not, and you're experiencing these ups and downs continually throughout the day or throughout the week, click the button below, schedule a free consult. That way we can get you some relief.